She told me that it was breast cancer, that it was ER/PR negative, and I was HER2 positive. What does that mean? Is that a good thing? Come to find out that HER2 is very aggressive.
You know, really, it used to be a terrible diagnosis, but today we have such specific treatment for it. It's actually one of the better types of breast cancer to have.
A drug called Herceptin was developed and approved by the FDA about 11 years ago. And that changed the landscape of the treatment of HER2-positive breast cancer. Herceptin and Projeta in combination with chemotherapy creates a great synergy that takes us to the success of being able to take patients to surgery and finding no tumor at the time of the surgery. That success rate is in the upwards of 80%. It changes the outcomes of patients if we're able to treat them first and hopefully get to the surgery and face a situation in which there's no cancer found in the breast or the lymph nodes at that time.
She received that preoperative chemotherapy, and then when she came back to see me, I could no longer feel the tumor because the chemotherapy had essentially melted the tumor away. Our options at that point would have been to either just remove the area of cancer, which we knew where it still was because they had placed a clip at the time of her biopsy. The other option is always to do a mastectomy.
June 30th was my double mastectomy and reconstructive surgery. They took 2 lymph nodes on my left, and there was no sign of cancer.
So far, the data continues to support the regimen that we chose as the standard of care. When I see my patients come back to the office when their hair is already grown back and they're back to work, it's really, really rewarding because I remember that those days that were a little tougher. The transition that we're trying to make is from a cancer patient to a cancer survivor.